financial services group Liberty has reported a spike in mental health claims in 2021, particularly among working people between the ages of 35 and 54 years of age. This has attributed to the impact of the COVID-19 pandemic. The company says claims under its flagship lifestyle protector policy shot up to 10.12 billion rand in 2021 from 6.43 billion rand. Let's get more on this. So we're joined by Chief Product Specialist for Product Marketing at Liberty Kedibone Malobela. Very good afternoon to you. Thank you so much for your time. The COVID-19 pandemic has certainly had a detrimental effect on the mental well-being of working people between the ages that you've allocated, 35 and 54. What are some of the contributing factors?
Thanks, Mpo. I think one of the most contributing factors, obviously, it was the stress that actually a lot of people went under during lockdown. I think, as you can imagine, a lot of people, for the first time, they will find themselves having to actually be constrained within their houses. People lost their jobs, and some people actually even had to find themselves in unfortunate situations where they were operating from households that suddenly had like shrunk income. So all those different levels of stress and anxiety is what probably we've seen coming through in terms of the claims that you've just actually reported.
And as we try perhaps to make sense of the breakdown in terms of percentage, where would you say that the bulk of the claims in terms of percentage went to?
So the bulk of the claims in terms of the percentage, we actually saw about 45% in major depression. So obviously then that was followed by the 15% in schizophrenia, and then what we had as a last was then 10% in dementia. So I think the bulk of it was major depression.
And you also made mention of the impact of unemployment. We know that the economy shed about 2.2 million jobs in the second quarter of 2020 because of the lockdown in the first wave. What have you noted with the rate of increase, especially just looking back from what we saw in 2020?
I guess what we saw, obviously from our insurance industry, we see it mostly when it comes through with the retrenchment claims that we have received. So I think coming from obviously then 2020 with the claims that we received, we went into lockdown and then we saw about 8% increase in like retrenchments around that time. Then when we went into 2021, what had happened is that obviously then the economy started slowly opening up, but then the recovery out of that whole unemployment state and everything, it has been slow. So what we've seen as a decrease is that it decreased from like 8% only to about 7.2%. So we're hoping that obviously then as we go into the following year, then the situation might look better.
The pandemic has surely demonstrated that life doesn't always follow a predictable course. In terms of also reflecting on the claims from clients, what would you advise, people to do when it comes to ensuring that they have some sort of coverage? I mean, mental health shooting up and spiking at such a tremendous rate speaks to the vulnerability of the situation.
I think the one thing that I would say is that, as we've just mentioned, we've just come out of a very hard situation where a lot of people have lost jobs. And I think in those times, there's always a temptation then to think of maybe then cancelling your cover, because obviously given the financial pressures. So what I'll probably then say to most of our clients is to say that sometimes it's better to have some level of cover than no cover. So you rather than maybe then contact your financial advisor and find arrangements about how much you can afford, and also then be able to prioritize the type of insurance cover that you need, because it's not all insurance cover that you may need, but there's certain ones that, given my situation, this is where my risk exposure is the most. Then with that, then you can get the level of cover that is in line with the affordability given your pockets at that time. And as things get better, do get in touch again with your financial advisor to try and obviously then adjust your cover back up to the levels of affordability that you can then afford when things look better.
And what factors perhaps influence the losses in terms of risk exposure? What should you be looking at?
Okay. So how we look at it from an insurance industry, we look at like live events. I think live events is the one important thing. One thing that I think it's a point in case is that when you start having children, that's another time when you need to probably then think about insurance. When you get married, suddenly then obviously then you have like a spouse, you have like a new family environment that you need to consider in terms of cover. Again, then another obviously live event is that if you suffer like a critical illness, a lot of us, I think, given medical aid, people are fortunate enough that they can be able to do annual screenings where you know that, you know, I'm at a high level of risk for this type of disease or for this kind of thing. Those are the type of things that before things get worse, then you should actually probably then speak to a financial advisor. And I think at last, probably what I'll say to most of our clients is that try to get cover earlier. The healthier you are, the much more affordable cover will be for you. As we all age, it is well known that obviously then even our health deteriorate, and obviously then that will affect the price of cover that you can afford. So I think try and get cover as early as possible.
Absolutely. Thank you so much for that. That was Chief Product Specialist for Product Marketing at Liberty, Kedibone Malobela, speaking to the mental health claims spiking because of the impact of the COVID-19